Hello class, my name is Shayna Bazella and I'm going to be discussing part 2 of the case study for SPCE 638. Just to start with a brief overview of the client background that was discussed in case study 1, the client is a female who is 6 years old and has a diagnosis of autism spectrum disorder. The behavioral target that I'll be discussing is noncompliance. This is defined as any instance of the client not beginning or finishing any academic or non-academic request within 3 seconds after instruction has been given, and this includes saying no or shaking head no. This behavior target was chosen because it was observed to be occurring at a very high frequency, as many times as 25 instances in a 2-hour observation period, and it's been having a very significant impact on her academic performance and daily functioning. The intervention that was used was functional communication training, also known as FCT. So if the client engaged in noncompliance to escape a task, she was then prompted to request for a break. We would allow her a break for 3 minutes, and then we would return to the task until completion. If the client engaged in noncompliance to gain access to items or activities, we would then prompt her to appropriately request for access to the item or activity, and it would then be provided to her upon appropriately requesting using FCT. The functional relevance of FCT is that it can effectively address both the escape maintained and access maintained functions of noncompliance. This particular intervention teaches alternative communication skills. For example, in the case of her noncompliance, requesting for a break or access to tangibles as a replacement behavior. Regarding the evidence-based nature of FCT, research by Lindgren et al. In 2020 demonstrated the effectiveness of this intervention in reducing various types of maladaptive behaviors, including noncompliance in children with ASD. These next slides will include the integration of the BACB task list items. The first task list item I'll be discussing is H1, state the intervention goals in observable and measurable terms. So all the intervention goals that were added to the behavior plan were written in observable and measurable terms. One example I provided was the goals for requesting a break. STO1 was that the client will request a break when provided with a full verbal prompt with 100% accuracy across 5 consecutive sessions. STO2 stated that the client will request a break when provided with a partial verbal prompt with 100% accuracy across 5 consecutive sessions. And the LTO was that the client will request a break independently with 100% accuracy across 10 consecutive sessions. The next task list item I'll be describing is H2, identify potential interventions based on assessment results and the best available scientific evidence. So as stated previously, the assessment results had shown that the function of the noncompliance was both escape and access to tangible, and FCT was implemented, which served both of these functions and was determined based on the best available scientific evidence, some of which I included in a previous slide. The next task list item that I'll be discussing is H3, recommend intervention goals and strategies based on such factors as client preferences, supporting environment, risk, constraints, and social validity. So the goals were tailored to align with the client's preferences and communication abilities. Her preferences were identified based on the utilization of a preference assessment. In addition, with regards to her communication abilities, she was verbal and had the ability to communicate her needs, making FCT an appropriate replacement goal. Additionally, we ensured consistency and generalization of skills across various environments. This included the school where ABA therapy was occurring and the home environment where the caregiver was also experiencing a high frequency of noncompliance. The next task list item that I'll be discussing is H4, when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. So the target behavior to be decreased was noncompliance, and the alternative behavior that was selected was functional communication training. This teaches communication skills to replace noncompliance, um, such as requesting a break or access to items. It encourages communication as a more functional response, and the desired behavior is increased through reinforcement of alternative behavior while placing the undesired behavior on extinction. The next task list item that I'll be discussing is H5, plan for possible unwanted effects when using reinforcement, extinction, and punishment procedures. So during the intervention phase, there was an initial spike in noncompliance, which was due to an extinction burst. Prior to the start of the intervention, the caregiver was notified of possible unwanted effects, such as an initial increase in the behavior when implementing behavior reduction goals. The next task list item that I will be discussing is H6, monitor client progress and treatment integrity. So data was collected on client progress during each session. Client progress was then monitored by generating graphs of client progress with visual analysis. And based on the data trends, it was then determined whether progress was being made or if changes were needed in cases of lack of progress. The next task list item that I'll be discussing is E2, determine when consent and assent should be gained with a client. So once the behavior plan was completed, it was then emailed to the parent of the client. The parent then reviewed the behavior plan and provided her consent for the implementation of the intervention goals by signing the document. The final task list item that I'll be discussing is E7, determine how to apply culturally sensitive interventions to your future practices as a behavior analyst. So throughout the process, I made sure that I acknowledged and respected the client's family's cultural background. I then identified and addressed any potential cultural barriers and made modifications to the programs as needed.